podcast, Niki Renslow, Senior Program Director with Family Source Consultants, and Dr. Brooke Friedman of San Diego Fertility Center discuss the journey of intended parents in selecting a fertility clinic and navigating the surrogacy process. The conversation covers essential topics such as the importance of experience and success rates in clinics, common misconceptions about fertility services, the involvement of intended parents in decision-making, and the collaboration between fertility clinics and surrogacy agencies. Dr. Friedman emphasizes the need for clear communication and outlines the steps involved in preparing surrogates for their journey. The episode also touches on innovations in fertility treatments and offers advice for new intended parents feeling overwhelmed by their choices.
Hi, everybody. Thank you so much for joining the Bringing Dreams and Miracles Together podcast hosted by Family Source Consultants. My name is Niki Renslow, and I'm the Senior Program Director here. And today I am joined by the lovely Dr. Friedman from San Diego Fertility. Hello, Dr. Friedman. How are you?
Hi, Niki. I'm great. It's great to be with you guys today.
Awesome. Thank you so much for joining us. I'm very excited to talk about what the journey looks like as an intended parent, choosing a fertility center, how the partnership with agencies works, all of these fun things. But before anything, do you mind introducing yourself and telling us a little bit about San Diego Fertility?
Absolutely. So I'm Dr. Brooke Friedman. I am a double board certified OBGYN and reproductive endocrinologist and infertility specialist. I have been practicing as a fertility specialist for over 12 years. I feel like I have the best job in the world, and it's really an honor and a privilege to help patients around the world build their families through egg donation and surrogacy. So I love what I get to do. I'm very, very lucky to work at San Diego Fertility Center. I have wonderful colleagues and partners and a wonderful team that we're all really aligned to helping patients build their families. So we are the clinic in the United States that does the highest number of surrogacy cases every year because we really have made that core to our mission of helping intended parents from around the world have the highest success rates and help them build their families. So we have a large team. We all are working together, but we love working with agencies like Family Source Consultants and have like a seamless process for our intended parents from start to finish. So it's exciting to get to chat with you today.
I love that. And we love obviously working with you. I didn't know you did the most surrogacy journeys.
We do.
That makes sense.
Well, as you know, it's really core to what we do, right?
Yeah.
And so we have a team and we can talk through kind of more about how that works, but definitely it's very core to our mission of helping intended parents around the world.
That's so wonderful. I love that so much. Can you kind of guide me and chat about what intended parents should look for when selecting a fertility clinic?
Absolutely. So I think first and foremost, experience, right? I think it's really important to ask a fertility clinic, how many surrogacy cases do you do a year? It's not just about the IVF process, although of course that is critical to the successful journey, but also behind the scenes, the team in terms of coordination with surrogate agencies, surrogate screening, if they're using an egg donor, medical screening, how to handle all of those logistics. And you really want to make sure you have a team that has excellent communication and excellent experience, depth of experience to coordinate all of those moving parts so that the intended parent has a seamless experience from start to finish. So experience matters. Success rates matter. So it's really important to ask fertility clinics about those success rates. Most fertility clinics do report their success rates to the CDC. So very important to ask about their success rates and how are they advancing the field. So one of the things that we're really proud to be a part of is research. So we're constantly looking at how do we improve, how do we contribute to research, to our professional national organizations, publishing and presenting our findings. So we want to keep working and keep getting better. And so if a clinic is doing things exactly the same way they were 10, 15 years ago, that's a little bit of a red flag. So we want to continue to advance the field and make it more effective and the safest possible IVF process it can be.
I love that. And I'm happy that you mentioned success rates because I was going to ask, right? Do you mind really explaining what you mean by success rates and what intended parents should look for when talking about them?
Yeah, so the way that success rates are often reported can be very confusing. And there are some clinics that just don't report any success rates. So oftentimes intended parents can feel a little bit lost. So definitely when we're truly defining success rates, in our opinion, that's a live birth, right? So we really want to look at kind of babies born. So asking about pregnancy rates per embryo transfer are important. Live birth per embryo transfer is important. So really trying to get a sense of how a clinic is defining success. But for us, we allow patients to move forward, even if they are not the highest prognosis patients. What I mean by that is we help a lot of older, like intended parents, if they want to use their eggs. So we're not here to turn people away and kind of cherry pick our patients. We want to give everyone a chance if they are hoping to, for example, use their eggs and they've been told maybe that's not an option for them. So I think it's really important to also have an understanding of the criteria, the exclusion criteria certain clinics have. Like, for example, certain clinics don't allow certain women to use their eggs over a certain age. So I think it's really important to get a sense of who they including, who they excluding, and how are they defining their success rates.
Awesome. Thank you so much for explaining those and breaking them down. So that's why also the communication with the surrogacy agency is important, because we update you on said live births.
Yes, absolutely, which we love. We're so grateful for, and we need that information. So because you want to keep track of these pregnancies.
Yeah, absolutely. Would you say, have you noticed or heard that there's any common misconceptions intended parents might have about fertility centers?
I think a little bit of a common misconception is that all fertility clinics are the same, and they're not. So I think it's really important to have an understanding of, for example, is the physician a double board certified OBGYN and reproductive endocrinologist and infertility specialist? So there are fertility centers where you don't have a double board certified physician who's a specialist in infertility. I think it's really important to know, do they have experience working with egg donors and with surrogates, and what their success rates are? And so I think every clinic is a little bit different, and it's important to appreciate those differences and to find a clinic that's the best fit for you. I think another misconception, we can talk about this a little bit more, is that if your surrogate is somewhere else in the country, you need to find a fertility clinic near that surrogate, and you don't. So we have surrogates flying in to us all the time from across the United States. They have to come here for medical screening and then come back for the transfer for only a very short period of time. But you don't need to find a fertility clinic located where your surrogate is. And you don't, vice versa, if you have your clinic, you don't need to find a surrogate. For example, in San Diego, they can live anywhere in the United States. And that works very well.
Perfect. And that's on the front end, right? We talk to intended parents or recipient parents or both, right? And the big question is, does the fertility clinic need to be local to me? Does the surrogate need to be local to the fertility clinic? And so it's definitely about
no and no.
No and no. Perfect. That's the best way to put it, right?
Yeah.
She's
Yeah.
going to fly in for medical screening and embryo transfer. And sometimes you need to go to the clinic, sometimes you don't, right? So we really want to focus on who's the best clinic for you, right? And those success rates. And that, to me, is going to be more important of a focus than location. Do you
absolutely
think along the same lines?
Absolutely. And so we help intended parents from around the world, some of whom actually have never come to San Diego. So for example, if it's a male-male couple, we have clinics in Europe where they can freeze sperm, do the FDA testing there, and then ship the frozen sperm to us. So there's a lot of ways for us to coordinate. Patients are busy. We understand that. So we work with some sites on the East Coast. There's a lot of different ways if patients don't want to come to San Diego, for example, for sperm freezing. There's ways that we can coordinate to try to minimize that burden on them, that logistical burden.
That's nice. You might not have to travel, but your surrogate will. We vet them, ensure they're comfortable traveling. We really care about where she lives and her laws. So that's the big concern. Laws, legally.
100%. 100%. Yeah. It's not even in California, it's not even in San Diego, but absolutely that's critically important.
Absolutely. Another big question that we get, and I would love to hear your answer, with this, is how involved are intended parents in decisions around egg donors, embryo creation, and honestly, even transfer protocols, right? Whether, having a conversation about medicated cycles versus natural cycles, how involved are they allowed to be?
Well, they're allowed to be as involved as they want to be, in the sense that, when I first meet with an intended parent, I like to start off by asking an open-ended question of, like, tell me what your family building goals are. Tell me what your dreams are for your family. How many children are you hoping to have? What does that look like? Are we using the intended parents' eggs? Are we using an egg donor? So really trying to listen and get a sense of what their goals are so that I can better understand how to create an individualized protocol to get them there. So there are some intended parents that want to be very involved at every step of the process and have a lot of questions about the science and what happens in the back end, which I'm happy to talk through with them. Obviously, I love this, and so I'm happy to talk through it. And other patients are not as interested in kind of the behind the scenes and kind of the nuts and bolts of the process. So we want to make the process as transparent as possible and demystify the process. But everyone's different in terms of their comfort level. What would make them feel more comfortable? Is that being more involved, or is that saying, okay, you guys create embryos and let me know? And so everyone's a little bit different, but we're very open to questions and we want to explain everything. So we're always happy to help answer questions.
That's fantastic. I say the same thing, right? When we onboard them as an agency, of course, we're very involved when it comes to choosing the egg donor and the surrogate, right? But we leave the medical decisions. We'll defer to the clinic, right? You review the medical records, the medical screening, know the best transfer protocols. So,
That's right.
but they're involved every step of the way.
Yeah, absolutely. As they should be, right? What's more important than building their family? So that's such a personal process as far as selecting the egg donor and the surrogate. But as you said, that's our job to medically screen the egg donor and the surrogate and really to come up with the most successful protocol.
Absolutely. I know you do so many initial consults with intended parents. What big questions do you recommend intended parents should be asking, of fertility clinics or even surrogacy agencies?
So I think we talked, about experience. We talked about success rates. I would also ask, who's my team, right? How do I get in touch with the doctor if I have questions? How do I reach my cycle coordinator? So I think communication, how the team is structured, making sure everything is very transparent and streamlined and that they're responsive to your questions. I think all of these things are really important. And I think one of the things I'm really proud of is having our larger team. I'm the captain of the ship, right? So I'm ultimately responsible for everything that happens. But we have our screening team coordinator, we have our cycle coordinators, we have our finance team. So everyone's working to create a seamless process. But I think it's really important to ask, who's my team and how do I communicate with my team, and to make sure that my questions are getting answered.
Completely agree. I love that. Thank you. I do want to chat a little bit about fertility centers and agency partnerships, right? How we work together. So if just discussing it and talking about it in general, how do fertility centers and surrogacy agencies work together when it comes to supporting intended parents?
I think it's really important, again, like we talked about experience on the clinic side, but you really want to make sure you're working with an agency like Family Source Consultants that has the experience, the depth, the team, right, to help answer questions and explain and help make sure that you're getting the best possible match. So I think on the back end, Niki and I know how we work behind the scenes, and there's a lot of communication that happens that doesn't necessarily have to involve the intended parent to make sure we're helping hit all of the important screening appointments and appointments for the surrogate. And so there's so many things happening on the back end. So that communication is really key, and that experience. So partnering with an agency that has that experience and can anticipate potential roadblocks and help avoid them is really critical. But I think communication is key, making sure that the clinic and the agency have a history of working well together, and really communicate.
Yeah. And, I explained there's someone with you from day one, right? Helping you create your matching profile. Once you're matched, sending the records to the clinic. We coordinate with the clinic to get your surrogate or egg donor in for screening. We book that travel, right? And then after match, get you through the legal process, continue to book travel, work with a local IVF clinic if your surrogate isn't local, work with the IVF clinic to get her there for transfer, or the same thing for your egg donor, right? With the egg retrieval. And I'm just like, well, we take all the logistics and we handle those, because happy intended parents, happy egg donors, happy surrogates.
That's right.
That's what we're looking for, right?
Right. Absolutely.
Yes. Professional travel booking agents, but definitely love coordinating.
Yeah, all of the things. Well, you're handling all of those things, right? And those sometimes when intended parents ask, well, what are all the things that the agency does? It's so many things. It's all of those things and more. And it's really important that not just the intended parents feel supported, but the surrogates feel supported through the journey. And you guys do a great job with that, supporting all parties. And so there's so much that goes on behind the scenes.
Right? There's a lot. I love it though. Absolutely. Have you seen, or do you think there's any red flags that agencies should look for when choosing clinic partners, or vice versa when it comes to clinics being willing to work with agencies, right? Are there specific red flags that you think clinics, surrogacy agencies should really look for?
Well, I think, again, kind of open, responsive communication is key. I think, again, experience is key. I think that, you know, if, emails are being sent and they're not being answered and kind of going into the void, and there's questions that are being unanswered, or, we're asking sometimes for further information about a surrogate during our medical screening process. And if there's, no support from the agency side, that can be difficult. I mean, it's not what happens with you guys. So I think, again, just making sure that everyone's working together as a team, really with the intended parent's best interest in mind. So sometimes when that communication breaks down, then that's where we have issues.
I agree. And
yeah.
I know
what other red flags would you say, Niki? What are there things that would
so I would say the same thing, right? Communication is key. If the clinic isn't really communicating with the intended parents or the agency, that gets difficult, right? Because we're the middle trying to coordinate, get your surrogate to screening, get her to transfer, or sometimes failed transfers happen, right? So what's the protocol? Have you, has the clinic spoken to the intended parents about next steps? Are we trying a different type of cycle, right? Have we had these conversations? And any type of drop of communication, I think that's where it gets a little nerve-wracking, right? And same thing, success rates, always, always, always. Have they worked with surrogates, right? Have they worked with intended parents? And so really having those conversations, making sure that the doctor is versed in surrogacy and surrogacy protocols. So I completely agree. I tell intended parents all the time, potential clients, we've been here for over 18 years, right? Like if we're recommending someone, we know that they're fantastic when it comes to surrogacy and working with intended parents, and surrogates are egg donors. Same thing with maybe legal partners or other third-party entities. You have people who've been doing it for a while. So I think
it matters.
It's a long time, which is a good thing.
Absolutely. Absolutely.
Yes. And talking about screenings, I love to ask you, Dr. Friedman, and I know we've talked about this before, but can you explain how the clinic helps ensure that the surrogate is physically and mentally prepared for the journey?
So I think, that preparation of the surrogate really starts with you guys as the agency. And if you do a great job of that due diligence and explaining the process from the beginning to the first question is, does the patient, does the surrogate know what they're getting into and everything that's involved in the process? So our experience tends to be that by the time surrogates get to us for screening, they're well informed and they understand kind of what they're getting into. But we want to make sure we walk them through all the medical aspects of the journey, so they understand what we're checking for during screening. They understand what the requirements are. So we really help explain what medications they're taking, what to expect at every step of the way from a medical perspective, because again, that's our responsibility. So the medical screening is really critically important, making sure we have all that encompasses with the medical screening as far as the psychology consultation, which is very standard and very important. We do all the screening with the hormones that are important for reproductive health, infectious disease testing, drug testing, etc. So everything that we're looking at in the clinic as well, anatomically doing what's called a seeming sonogram or a water ultrasound to look inside the uterus to make sure there's no polyps or anything structural that would interfere with an embryo implanting. So after we've completed all of that, and after that thorough medical record review has been done even before they come here in person, right? So the medical record review, the in-person medical screening, then we issue medical clearance, and then the intended parent sign the legal contracts. So a lot has to happen before we provide medical clearance, both for the health and safety of the surrogate and also for the intended parents. We want to do everything we can to maximize the chance of having a healthy, uncomplicated delivery.
Absolutely. That's why the intake process is so important. And not everybody who applies, unfortunately, can be a surrogate, right? Because
Hmm.
of
That's
the
right.
guidelines, the medical history. I know our intake team, they do a fantastic job. We're doing
They
background
do.
checks, right? Which is very
Mhm.
important. Collecting pregnancy, delivery records, OBGYN clearance, right? Last
Mhm.
pap smear to
That's
make
right.
sure that that's been normal, as well as
Mhm.
making sure that they do their mental health evaluation, right? So typically there's a PAI involved with that, which is that wonderful psychological assessment. And then you meet with our mental health professional, who's fantastic, because really we want to make sure, yes, physically, medically, yeah, if you can move forward with this, that's wonderful. But we also want to make sure mentally this is something that you're prepared for, right?
Absolutely.
And so just making sure that all those boxes are checked. And then from there, they pass medical screening. I know that will assist in recommending, third party legal partners. As a clinic, is there anything additionally that you do, like legally, ethically, or psychologically, that you need to consider when it comes to a surrogacy journey with intended parents?
Well, I think as you alluded to, it's really important to us to try to adhere to our professional guidelines. The American Society for Reproductive Medicine has criteria as far as who is allowed to be a surrogate, who shouldn't be a surrogate. So we really want to adhere to those professional guidelines. And when the surrogates here again do our thorough medical screening and evaluation to be sure that there are no red flags or concerns. So I think it's really working hand in hand the agencies with all the testing and, like you said, background checks and things you do far well in advance, right? Prior to that medical screening process even happens. But for us, we're really doing our due diligence, combing through medical records, doing our in-person medical evaluation, making sure that everything looks good and that surrogate is as healthy as possible, both physically and, as you mentioned, mentally too, which is so important.
Yeah, 1,000%. Thank you for clarifying that. I do have a few more questions, so thanks for hanging in here with me.
Or
I know, long time ago, I was a surrogate, 2013, right? Long, long time ago. And we know maybe the procedures were a little bit different back then. I know you've been doing this for a while, Dr. Freeman.
I have,
How has the relationship between agencies and clinics, how would you say that has evolved over the last 5 to 10 years, or even medical procedures when it comes to surrogacy? Have you seen an evolution or a change there?
I think one of the largest changes in the field is a shift away from double embryo transfer towards
Hmm.
single embryo transfer. I think as our IVF success rates get better and better, as we're able to do PGT, pre-implantation genetic testing of embryos for genetic screening, we really don't need to transfer multiple embryos at a time to help intended parents have a high success rate. So by focusing really on single embryo transfer, we're reducing risk not only for the surrogate in terms of the risk of potential complications of twins, but for the intended parent to help reduce the risk of having a premature delivery. So I think that shift from double embryo transfer to single embryo transfer in the past 10 years has been significant. And again, we keep encouraging patients for single embryo transfer because we want to do everything we can to reduce risks not only for the surrogate but for the intended parents to maximize the chance of having a
Mhm.
healthy,
Yeah, I
uncomplicated
agree.
delivery.
What do you think about when I was I go off my experience a lot, right? I was in the fresh transfer era, right? This
Yes,
is when
that's right. That's an important point. You're
right,
right.
the egg
That's
donor
changed a
cycled
lot.
with the
That's right.
surrogate, and I
That's
lived
right.
in Arizona, right? The clinic was in another state, so I was there for 10 days because we didn't know, am I going to transfer
Oh
day
my goodness.
3, 5, or 7,
Oh
right?
my goodness. Yeah.
Um, have you drifted away more from those fresh transfers, and now we're freezing embryos, doing PGT testing, and can really narrow down when a surrogate needs to be there?
So that's a great, great point. So
Uh-huh.
it's been so long we've been doing it this way. It's
Right?
I forgot what it was like 10 years ago. So you're right. So over the past 10 years, we've really switched and are doing essentially exclusively frozen embryo transfer. So
Hmm.
just to make sure everyone understands what we're talking about, fresh would be, let's say it's an egg donor cycle, retrieving those eggs, creating embryos, and as you mentioned, Nikki, then immediately putting an embryo back 3 days after fertilization or 5 days after fertilization into a surrogate. We really don't do that anymore. So what
Yeah.
we're doing at this point is taking the eggs out from the egg donor, creating embryos, growing the embryos in the lab, culturing them to what's called the blastocyst stage after 5 or 6 days after fertilization, and then doing genetic testing most of the time on those embryos. So by culturing to the blastocyst stage, by freezing embryos, we're really helping increase success rates, having a much better understanding of which embryo is the most viable for transfer. And then logistically, that means the surrogate can plan far in advance when that transfer is going to occur. So the month before, we can say, okay, it's going to be on this Thursday. So she can plan her life around that and understand for childcare and balancing her life and work and travel plans, and only need to be here for 3 days. So she would fly in the day before the transfer, be here for the day of the transfer, and wait 24 hours before going home. So that's a lot better than 10 days of not knowing when the transfer is going to be. So we have a lot more control about the process, a lot more scientific, a lot more precise. So definitely that's a big advantage.
Right. And then they would call, okay, transfer will be tomorrow at this time. And you're like, great. So yeah, I
Not a whole lot of
it now.
yeah.
It's fun. I love talking to, women who have been surrogates, and it was, 10 years or more ago. And I'm like, did you do a fresh transfer? And they're like, yep, just kind of hung out for 10 days because we didn't know. And I'm like, yeah, it's great.
Yeah, you're right. You're right. Yeah, that's a big difference now.
Right. I love talking about that. So it brings me into all the innovations, right? Like you said, what are the clinics doing to advance fertility treatments and, come up with new processes or procedures? Do you think there's any specific innovations or trends that are emerging in fertility care in general that will impact intended parents within the next couple of years?
I think, things that are very cutting edge that we're looking at in the lab, things like how do we utilize potential AI as far as embryo selection and time-lapse imaging with embryo development. We're looking at different kind of aspects of PGT testing. So I think there's going to be some more advances on the lab side, which will be interesting as far as kind of more information regarding the embryos. So I think that's something that is very cutting edge, and we'll see how that plays out in the coming years.
Yeah, I've wondered with the emergence of AI if we're going to see some innovations there. So
yeah,
I'm excited.
Yeah,
we'll
be interesting to see how that. Oh, I know.
Awesome. Okay, so big question. It's my final question. But what advice would you give to someone just starting their journey who's feeling overwhelmed by all the choices? There's this many agencies, this many clinics, right? What do I need to do? I'm overwhelmed. What advice as the medical professional do you give to them?
Yeah. So I would say it's, as you say, Niki, it's difficult to make all of those decisions at once, right? So my best advice is to tell patients to get one step at a time. You don't need to make every decision at once. So one step at a time. You can first choose your fertility clinic or first choose your agency. So again, you have to create embryos first, right? Before you match with a surrogate. So there's things that we can do in a stepwise approach where you can focus first on selecting your egg donor and not worry about selecting your surrogate yet, because you have to make embryos first. So I think sometimes intended parents be like, I have to make all these decisions at the same time, and say one step at a time, right? We're all here to help guide you, but I think breaking up the journey into bite-sized steps and just really thinking about it in a stepwise approach makes it feel more manageable than, oh my goodness, I have to do all of these things at once. I have to make all these decisions at the same time. You don't. You absolutely can take it one step at a time.
Yeah, absolutely. I explain the same way, right? We know there's going to be just that small wait time to find your surrogate over here, right? So you sign up and then boop, 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 that time's ticking away. You don't need to worry about it. So then over here, we'll establish with the fertility clinic, help get you an egg donor, help create those embryos, right? And so you can do both, but you don't need to worry that it all needs to be done at the same time. So that's same piece of advice, right?
One step at a time.
One step at a time. We will get you there. I promise.
Right.
Trust the process.
That's right. That's right. And I think you raise an important point too, is that understanding it is a process and it does take time. I know everyone is anxious to move forward quickly, but we really want to be thoughtful and thorough in our medical screening in every step of the process. So I know it doesn't move as quickly as intended parents would like it to, but that's really because we're 100% dedicated to making it the safest, most successful process possible, and sometimes that takes some time.
Exactly. Same thing, right? We want to make sure we take the time to match you with the surrogate that we think is going to be perfect for you.
Absolutely.
You're going to take your time making sure that the medical screening looks great while she's cycling on medications, that her labs look good, that her uterine lining is perfect. And if it's not,
Okay.
maybe adjusting that a little bit. And, that may change the transfer date. But again, it's for the best outcome, right? That's the ultimate goal, because the final goal is to help see that little one in your arms.
That's exactly right. That's why we're all doing what we're doing, right?
Yes.
That's the goal, is helping people build their families.
I love it. Well, I thank you so much, Dr. Friedman, for meeting with me and having this conversation today. And I look forward to many more.
Hi, it's my pleasure, Niki. Thank you for having me. We love working with you guys, and we look forward to continue to do so. Many. Take care, Niki.
Awesome. Thank you. You too.
Okay. Bye-bye.